My name is Peggy. Welcome to Channel 20 News. Thanks for joining us on this beautiful morning. Well, today we'd like to jump into our lead story about a death of a local teenager, Caitlin Brown, after swimming in a Florida lake. It is said that she contracted an amoeba and developed a deadly disease called PAM, and died shortly after. We will now go to an interview with Dr. Miller, who specializes in this field of protists.
So, Dr. Miller, what exactly killed this teenager?
Well, John, the scientific term for this protist is Naegleria fowleri, a deadly single-celled pathogenic amoeba.
So where specifically is this amoeba growing and thriving?
Well, this amoeba is reasonably rare. They commonly live in freshwater lakes, ponds, and rivers, but have also been known to thrive in poorly chlorinated pools. Some tap water, soil, geothermal, hot springs, and water sources. They are very sensitive to environmental conditions, such as aridity and pH extremes, and cannot survive in seawater. We don't know why exactly they're growing here, but we're sure it's because of the high temperature and droughts causing the water level to decrease in the lakes, because it mainly lives in the shallower parts of waters. The warmer temperatures are increasing their growth.
How exactly does it enter the body?
Mainly after diving or swimming in with warm, freshwater bodies of water, like lakes, rivers, or ponds. They enter the nose and invade. They enter the nose and enter the olfactory mucosa and molds, penetrate the submucosal nerve plexus, invade the cerebriform plate, and reach the subarachnoid space.
So what disease does this cause, and what are the symptoms?
The name of the disease they cause is called primary amoebic meningoencephalitis, commonly known as PAM. In the first stages of infection, it may seem like the flu or bacterial meningitis. Initial symptoms occur 1 to 7 days after the infection, and symptoms include headaches, fever, nausea, vomiting, and stiff neck. As the infection progresses, the later symptoms include confusion, lack of attention to people or surroundings, loss of balance, seizures, and hallucinations.
So, how long do you have to live, or how long until you realize that you have been infected?
Well, death usually occurs within 1 or 12 days. PAM is a rapidly fatal CNS infection that develops several days after exposure. Even with hospital treatment, many still die within a 2-week time frame. If caught early enough, it can possibly be cured, but most of the time the infection progresses so quickly that there's no time to know if you have it in time, because 90% of the time you die from this disease. You don't have a high chance of living.
What exactly does it do, and how fast does it progress?
Well, the trophocytes enter the ventricular system through the foramen of Lucia magni and reach the coronating plexus. These then destroy the epidermal layer of the third, fourth, and lateral ventricles and produce acute appendicitis. They multiply by a process known as promitosis, during which an intact nuclear membrane is present. Only trophocytes are found in pathologic lesions in humans. Trophocytes, or cysts, which give rise to trophocytes after they excise, penetrate the nasal mucosa and ascend along the olfactory nerves after phagocytosis by sustentacular cells of the neuroepithelium. Subsequently, they pass through the cerebriform plate to invade brain tissue, resultant purulent meningitis and encephalitis. Glucose and protein in the CSF support the growth and multiplication of the amoeba. The high content of oxygen in the CSF and in the brain also facilitates growth of the amoeba. Basically, it enters through the nose and into the brain and eats away the tissue.
Are there any known survivors to this aggressive disease?
Not very many, but for the very rare few that have survived PAM, it was recognized very early, allowing for early institution of aggressive therapy. Most survivors have some residual physical or cognitive impairment. Some of the lucky ones live with no neurological.
So, are there any more facts you know?
Well, a couple of random facts are PAM has a female ratio of 3 to 1, although PMA has no natural sexual predominance in male dominance and this disease occurs more often in children, possibly because more towards
Oh, so, someone take it down. Do our show. Appreciate it very much. And thank you, viewers, for tuning in to our morning session. And please join us again later for our evening session tonight. Signing out, I'm Peggy.
Thank you again for tuning in, and join us again later